Poisoning can happen in many ways: by ingesting something toxic, inhaling harmful fumes, getting chemicals on your skin, or through injection, such as from venoms. It can involve household cleaners, medications, alcohol, gases like carbon monoxide, or even some plants or foods. Even things like medical patches, which children sometimes mistake for stickers, can be dangerous if used incorrectly. The symptoms and severity of poisoning can vary, but the most important thing is to stay calm and act quickly. If you think someone has been poisoned, stop and assess the situation. Look for warning signs like sudden confusion, vomiting, difficulty breathing or not breathing at all, chest pain, burns around the mouth or skin, breath that smells like chemicals, dizziness, drowsiness or acting strangely, and seizures. Sometimes the signs are subtle, and other times they're immediate and severe. Call your local poison control center right away or dial 911 if the person is unconscious, having trouble breathing, or experiencing a seizure. In Canada, you can call 1-844-POISON-X to reach poison control from anywhere. If it's safe to do so, have the substance nearby so you can read the label or describe it clearly. Be ready to share the person's symptoms, their age and weight, and the name on the bottle or substance, estimated amount, and time of exposure. Poison control is also a resource for accidental or intentional overdoses. These are types of poisoning too. The first step is to make sure that the area is safe for you. If there are fumes, chemicals, or a risk of exposure, don't put yourself in danger. Ventilate the area if possible and avoid direct contact with the substance. Wear gloves if you have them. Do not try to make the person vomit unless a medical professional instructs you to. Vomiting can actually cause more damage, especially if the poison is corrosive. Also, don't give anything to eat or drink, including milk or water, unless poison control advises it. These can sometimes make the situation worse depending on the substance. If the poison is on the skin, rinse the area with lots of clean water for at least 15 minutes and remove any contaminated clothing. This helps stop the chemical from spreading or absorbing further. If it's in the eyes, flush with clean, lukewarm water right away and keep rinsing while you call for help. If the poison was inhaled, move the person into fresh air immediately, but only if it is safe for you to do so. If an opioid overdose is suspected, administer Narcan or naloxone if it's available. Stay with the person and follow the instructions from poison control or emergency responders. If they become unresponsive and stop breathing, call 911 and begin CPR if you're trained. If the poisoning is from inhaling toxic fumes, do not perform mouth-to-mouth. Do chest compressions only. Poisoning can be scary, but responding quickly and calmly makes a big difference. To help prevent poisoning, always store harmful products out of reach of children, never take or share medications without proper guidance, and keep the poison control number on your fridge or saved in your phone for easy access. And remember, if you're ever unsure, it's always better to call poison control and ask.